Hi, my name is Ibrahim Aldoss from City of Hope, California. So the treatment of relapsed refractory ALL has witnessed significant progress in the last 5 years, and this was mainly driven with the introduction of immune therapy. Nowadays, we have two approved CD19 target immune therapy. We have the blinatumomab, which is bispecific CD3, CD19 T-cell engager, and we have the Kymriah, which is a CD19 CAR T-cell therapy. And both drugs are associated with high response rates. And with CD19 CAR T-cell therapy, these responses can be seen as durable responses even without transplant. However, it's only approved for patients up to age 25 with relapsed refractory ALL. On the other hand, blinatumomab is approved for all ages, and it has shown excellent response and represents an excellent agent as bridging to go to transplant in relapsed refractory B-cell ALL. And blinatumomab is also approved for MRD positive ALL with high MRD response. And some of these patients who are treated in MRD setting can actually achieve durable remission and potentially cure even without transplant. And now the field of immune therapy in ALL is evolving rapidly. So we see some efforts to bring blinatumomab in frontline settings in older adults with Ph-negative B-cell ALL, since these patients, they don't do well with chemotherapy. And this is being studied either as single agent, like what was studied in the SWOG 1318 study, where older adults receive blinatumomab, then they receive pump maintenance. And early data show promising results and low treatment-related mortality, but also is being tested after cytoreduction therapy with the goal of kind of reducing toxicity and improve response in these patients. So we see that in MD Anderson, blinatumomab is given as a consolidation after cytoreduction with mini-CVD and inotuzumab. And we see the Alliance 041703, where blinatumomab is given after inotuzumab. And currently, Amgen is planning a phase 3 randomized international study in older patients where they're comparing blinatumomab with attenuated chemotherapy versus standard of care. And the hope that once these results are mature, that potentially can change the standard of care for newly diagnosed patients with B-cell ALL. And we see that blinatumomab was also added to Ph-positive newly diagnosed ALL patients. And now we have these chemo-free regimens where patients receive tyrosine kinase inhibitor with blinatumomab. Data from the Italian experience was published showing very promising results. And there are other ongoing studies using either the dasatinib or third-generation tyrosine kinase ponatinib in combination with blinatumomab. And simultaneously, we see that blinatumomab is also being tested as a consolidation in young adults with newly diagnosed ALL, more as a consolidation after initial induction, like what was done in the ECOG 1910. And if this proved to be more effective than standard chemotherapy, that could change the standard of care for these patients. Now, moving to the CD19 CAR T-cell therapy, while it's only approved for patients up to age 25, there are several studies that show an activity and safety in adults as well. And recently, there's a ZUMA-3 study was published that's showing excellent response and durable remission in some patients, even without transplant consolidation. So hopefully, this will be approved in all ages adults in the near future. And since one of the challenges of treating patients with CD19 target therapy, that the loss of CD19 antigen, the field is evolving, and now we have actually a new immune therapy target different targets like CD22 CAR T-cell therapy that has shown promising response. We have the BAFF-R CAR T-cells, which is ongoing. We have bispecific antibody immune therapy target different antigen like CD123 and others. And finally, I just want to conclude with recent progress in immune therapy in T-cell ALL. a disease that's really challenging if it's relapse or refractory to initial therapy, since options are very limited. And now we're seeing some CAR T cell studies targeting either CD7 or CD5 in this setting, and if proven to be active, this will be a huge progress in the field as well.